Children are very complex. They have many layers. With children who have ADHD, may also be on the spectrum. Some children have oppositional defiance, and on any given day it's very difficult to determine some steps that you need to put in place dependent on the situation and the incident that's occurred. And sometimes children coming to school in the morning, we don't know what's happened for them coming to school, so we really have to just work with different strategies we've learned along the way that have worked with children.
It often starts though with us, with a teacher noticing behaviours or issues or learning experiences for the children where they're having trouble attending or engaging with the curriculum. And we have a process at our school where we have a team that meets and helps discuss those things. And our first port of call is making a plan and then talking with the parents about that plan. If we've made some, anecdotal records that make the teacher feel that there is something underlying their inability to engage with the curriculum, then we would often have a meeting and ask the parents to do a battery of things. We certainly don't diagnose children, but once they have got a diagnosis from a paediatrician, we then have a process where we get a verification, and that verification means that we can gain much more support for that child within our educational setting.
So within schools there are varying opinions about labelling children with different disabilities or behavioural challenges. I think it is important within a school that children do have some sort of banner or come under a banner.
Is sometimes a good thing because it helps the teacher come from a better place of understanding of how to differentiate and support that child. Sometimes children, especially with attention deficit disorder or ADHD, are labelled the naughty kid, the kid who just doesn't want to learn. So they're getting a label anyway, but if it's a medical diagnosis, I think sometimes that can help teachers make those differentiation plans for children and make sure they can access the learning.
They are very accepting, they understand them, they speak to them differently, they'll help them get from point A to B within our school. However, I do tend to see around the age of 9-10, which is year 4 or 5, some students definitely start to see the differences in other children and what they can and can't do.
Kids are usually very accepting. They're very understanding when you have a talk to them in your teaching that everyone's different and everyone has different strengths and weaknesses.
So my advice would be to, when you're on prac, soak up everything that you can see from those experienced teachers on how to manage behaviours, because if you get your behaviour management skills really fine-tuned, everything else in your classroom can be learnt, can be build capacity in. But if you're not good at managing behaviours, you'll find even the really good children will become a problem for you. I would also say when you start, get a mentor, don't be afraid to ask for help, ask the person beside you or another person experienced in the school, ask them questions, write things down, ask them, go in and ask for time to observe how other people work, because watching others work will be of the greatest value when you're looking at tricky behaviours or when you're looking at how you explicitly differentiate for those children who will be across the sector of your class who have learning difficulties, or even for the other end, those children who require you to extend their learning.
Write all notes down, anecdote everything formally, even in a Word document. Speak to your year level coordinator or case manager about these students. Really be clear with what you're observing and what you're seeing, what the children can do, what the children can't do, how they are socially, how they are emotionally. And I think you really then need to step it forward, talking to administration, talking to a guidance officer, even speaking to a chaplain. All of those things, I think you need to have clear notes, and then speak to the people that you think will give you the best advice within the school. And
my biggest advice to you is that every child has a story. So just like you might have run out of petrol and spilt your breakfast down your top on the way to work, each of the children in your class has a story before they get to you. So a lot of the times the behaviours that we see in the classroom is an outward reflection of other things that are going on in their lives. They could just be tired, or they might have a grandmother who's passing away. We don't know, and as the people that they spend the most time with, apart from their parents, sometimes more during the week if they're in before and after school care, it's our job to really be there, to listen to them, and to get to know them so that we know their personal cues, their needs, and make their learning environment as safe as possible. So